There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what can high blood pressure cause? Answer by Angela Kunis. However, it is very quick and easy to diagnose hypertension. After that, you need to work with your GP, who will develop a treatment plan for you. Video, blood pressure exercises vs LCB. Essential hypertension develops slowly over the years, which is why it is symptomless, or asymptomatic, most of the time until something triggers a heart attack, stroke or another condition. All of your medication will be delivered in plain, unlabeled packaging. A signature will be required, but it does not have to be the patient. Dr. Ed is a brand you can trust. We've treated 1 million patients since 2011, and are certified by the CQC and MHRA. Answer by Manisha Saxena. High blood pressure. These symptoms may mean you have this, so lower down your blood pressure. High blood pressure is defined as high tension in the arteries, which are the vessels that carry blood from the heart to the rest of the body. Anyone whose blood pressure is 140/90ths of a millimeter Hg or more for a sustained period is said to have high blood pressure, or hypertension. People who are determined with high blood pressure should have their blood pressure checked frequently. Even if yours is normal, you should have it checked at least once every 5 years, and more often if you have any contributory factors. If the high blood pressure is not treated or controlled, the excessive pressure on the artery walls can lead to damage of the blood vessels, cardiovascular disease, as well as vital organs. The extent of damage depends on 2 factors, the severity of the high blood pressure and how long it goes on for untreated. Even though there is no any cause identified for essential high blood pressure, however, there is very strong evidence linking some risk factors to the likelihood of developing the condition. Treatment for high blood pressure depends on several factors, such as severity, associated risks of developing stroke or cardiovascular disease, etc. Answer by Paul Wilson. With my patients, I remind them that hypertension is called the silent killer. Eventually it will kill you without giving you any signs or symptoms. This of course happens over years, unless you have a major arterial rupture in the brain at a weakened area, usually the brain called an aneurysm. The slow and steady ways are kidney failure, and congestive heart failure, CHF. The kidney is composed of millions of small hair-like blood vessels. When blood pressure is high, these hair-like blood vessels rupture and are never repaired. This will eventually lead to severe kidney dysfunction requiring dialysis to keep you alive. This is a 6-hour procedure 3 times a week. Nothing to look forward to. Now for CHF. If I made you bend your arm every time your heart beat, your arm would get tired, but it would not get bigger. Now if I added a small weight to your hand and you had to lift that weight, your arm would also tire, but it would also get bigger. If you plucked a small chunk of ear muscle and a small chunk of arm muscle, you could put them side by side and not be able to tell the difference. However, under a microscope you would see a slight difference in the heart muscle. So being similar, heart muscle will enlarge with extra effort. Pumping against high blood pressure is generally extra effort. Now put your hands together as you did when you were a child. Remember squeezing those hands and causing them to eject water up like a clam, we used to say. Now bend the fingers of one hand outwards and leave a big space between your closed hands. Now imagine trying to squeeze them underwater. Not much water coming up, right? Well, that is how the heart works. The heart squeezes against itself. As it becomes bigger, the less it functions as a pump. The athlete's heart pumps say 75% out each time it beats. The very young adults say 65%, and the functional older heart 55%. Now imagine an enlarging heart pumping less than 55%, and gradually getting to 40%. You are now in CHF. The average white person in America gets CHF around 55 years old. 50% are dead by 60 years old. The rest straggle on for a few years at most. No medications, no procedures, no surgical interventions. Just impending death. That is CHF. CHF, where your output is 40%, means the body's organs are not getting the blood supply they need and begin a slow process of dying. CHF with a cardiac output of around 20% and you are a cardiac cripple, unable to walk across a room without exhaustion. Our African American population have 3 times more hypertension than white Americans. So you would think 3 times more CHF. Not 3 times more at 20. They can see it as early as 35 years old, yet they still die 5 years later. Control your blood pressure. Diet has a limited potential. Look into medication.